Hello, my name is Lauren Kerr, and today I'm going to be talking about electronic health record system data and its potential uses in public health surveillance. In a typical visit to a doctor or a hospital, you're likely to observe a clinician or nurse spend a good amount of time typing symptoms and other data into a computer. But what happens to this data after it's been captured, and what is done with the data? This question leads the curious-minded individual into the complex field of biomedical informatics. Biomedical informatics is a multidisciplinary field that manages and utilizes biomedical data, information, and knowledge. Biomedical informatics is a field that produces research and tools that are utilized for problem solving and decision making in biomedical fields. Biomedical informatics is considered by many to be a subfield of information science, although it incorporates aspects of computer science, cognitive science, social science, engineering, and clinical science. This presentation focuses on the use of digital patient data for public health surveillance, reporting, and research. Public health is a field of healthcare that typically focuses on preventative health and socio-behavioral factors of health. Public health focuses on how to prevent illnesses and detect new outbreaks of disease. Public health looks at population-level health issues. Because of this, having large data sets is incredibly important. So what happens to your data after it's collected? Patient data originates at the doctor's office, then makes its way from the electronic health record system, called an EHR, into a computerized clinical information system, called a CIS. This system interprets and transfers information transcribed by the doctor into various terminologies used by various different entities, including ordering diagnostic tests and images, reporting the results of those tests or images, submitting information to other medical professionals, reporting billing information, and reporting morbidity and mortality statistics to institutions like the World Health Organization. This data contains a wealth of knowledge about health conditions, but access to it is often difficult and cost prohibitive. Since the public health field is reliant on population-level research, it requires large data sets. Because of this, EHR data has the potential to contribute a wealth of knowledge to the public health field. Public health officials could theoretically use this data to run statistical analyses about different health conditions that could contribute greatly to our understanding of these conditions. EHR data could also provide effective surveillance of diseases for epidemiology, a subset of public health that monitors and tracks disease outbreaks. A public health system that links EHR data could provide real-time monitoring of health conditions and enable rapid response rates for disease outbreak. Despite the advances in science, there is still much to be learned in the medical field. Access to EHR data could provide fascinating insights into the development of different conditions and the environmental factors that may cause them. For example, if 95% of patients reported a strange rash a few months before being diagnosed with liver disease, scientists with access to the EHR data could use this data to see if there is a statistically significant association between a rash and the early onset of liver disease. This could lead to better preventative treatment measures and early diagnosis and interventions. Despite the many scientific benefits of using EHR data for public health, there are many political, technical, and security issues that prevent public health agencies from having access to this data. In the United States, patients do not own their data in the EHR systems. Rather, the medical provider retains ownership over that data. This means that the data in EHR systems is often proprietary and prevents public health agencies from being able to access it unless it is paid for at a steep price. Additionally, public health agencies must ensure that doctor-patient confidentiality is maintained, and the data transmitted must be secure and anonymized. There are also issues with the limited consensus on standardization of EHR systems and what data would be required for public health surveillance. The standards that do exist do not have a framework that considers the needs of public health agencies. Additionally, different facilities use different systems, which results in interoperability issues when data is provided from multiple EHR systems. Despite the issues faced using EHR system data for public health studies, many agencies are working towards novel solutions that allow access to this data while working within existing infrastructure. One example of this can be seen in a pilot project from the Maryland Department of Public Health. The Maryland Department of Public Health developed a system called the MDPHNet. The MDPHNet allows the Maryland Department of Public Health to access EHR data using a distributed network that allows the data to remain behind the firewall of the health provider, but still allows the public health department to access that data for queries. This eliminates the need for data transfer, a step that often makes data insecure and vulnerable. It also eliminates error from re-entering the data once it's received. It also solves the problem of proprietary data ownership and reduces the need for high-capacity data storage at often limited public health agencies. Another novel solution is data mining. Data mining allows for free text queries of data using keyword searches. This is particularly useful for the free text portion of the EHR records where doctors often jot down notes without standardized terminologies. Data mining reduces the amount of data cleanup needed and allows for more flexible searches that take into account different synonyms that may be used for different conditions. The use of big data in public health is a fascinating topic that could lead to novel discoveries in the medical field once an infrastructure has developed that supports the use of EHR data for public health. Thanks for watching.